Hello, I'm Jackie at Pure Calm Massage. You may recognise me at work there on the couch in the pre-COVID-19 days. I've just put together this short video for you to describe to you all the new hygiene protocols that are now in place at Pure Calm Massage, so that you will hopefully feel when you come along for a treatment that you are safe from infection, and that you will go ahead and book if you haven't already done that. So the aims are to make you feel safe, as I've already said. I'm going to explain hygiene procedures that I already had in place before the outbreak of the pandemic. The training that I've now undergone so that I understand how to control cross-infection, and what I've put in place to make sure that you, me, everybody else in the home, because I do work from home, are safe from catching COVID-19 while they're here, as far as I possibly can. So the mantra of all massage therapists is to do no harm. There have always been hygiene procedures in place to ensure your safety and avoid any cross-infection of any kind while you're here, and those are: I've always cleaned the treatment room, I've always disinfected your bathroom, I've always changed any towels on the couch or in the bathroom that have been used or that haven't been used, I've always changed the couch linens. You've always had fresh sheets. You know I don't use paper because I don't like to, well, firstly, I don't like it, nor do many clients, and secondly, because I'm trying to reduce waste. I've always washed everything at 60 degrees. I've always had my hair tied up when it's long enough to be tied up, which currently it most certainly is, needs cutting. I've always clipped my nails, not just to avoid scratching you, but also because with short nails, you're less likely to harbour any germs underneath the nail. I've always washed my hands regularly before, sometimes during, after treatments. I've always changed my uniform. For me, that is a t-shirt and leggings for comfort. And I've always used a spatula to take the massage wax out of the pot before putting it on your body, so I don't dip my fingers in and out, so there's no double dipping and cross-contamination that way. That will change a bit. Some hygiene procedures are going to be even more thorough because they have to be. So I'm now qualified in the control of cross-infection in the post-COVID-19 world. I know how to identify infection hazards. I know what the legal requirements and best practices are for massage therapists. I know to control cross-infection so far as this is reasonably practicable. I will do everything I can. I know how to identify risk and put in place appropriate actions. You'll see my certificate on the screen here. You'll see the name Jacqueline Howis. That is me. I practice under my maiden name of Dexter because I was once a school teacher and had two careers running alongside each other. So I chose to practice in the name as Dexter, but all my certificates say Howis. So I now have a full risk assessment and action plan in place to make sure that everything's tickety-boo and ready to go. So in addition to what I've always done, this is what I will now be doing before and after every appointment, so between every client. In this context, cleaning means washing with hot soapy water, a detergent, changing the cloth regularly, possibly using disposable cloths. I'll see how it goes. Washing those cloths at least 90 degrees. Sanitisation means using household bleach. Undiluted Domestos straight from the bottle is the strength required, or 70% rubbing alcohol. It depends what I'm cleaning. Obviously, some surfaces are more sensitive than others. So everything on your route from the door, up the stairs, along the landing, and into the room will be sanitised. Everything that's there on the screen, all walls if they need to be wiped down, if I think somebody may have brushed against them. The handrail on the stairs, I encourage you to use that handrail for your own safety as you go up the stairs. It will have been cleaned and sanitised, so it should be safe for you. If you want to wear a glove when you come in, that's fine with me. The carpet in the treatment room will be steam cleaned. So if you've been here before, you know I've got ridiculous colour carpets, so I'm always having to clean them to keep them looking nice anyway, but this will be an extra step that I take to make sure that the carpet is clean between clients. Sanitisation of your couch. So apart from changing the sheets, the couch itself will be washed and sanitised. The face cradle cushion, the horseshoe shaped cushion that you put your face into, I will wash and sanitize that, but then I will change it for each client. I've got lots of them. So because of the surface that's on the cradle, and because I don't want you putting your face into plastic, I would prefer to change the cushion and then put those cushions aside for at least 72 hours and not use them in that time. Between, before, after, if you want the window open during your treatment, that's fine. I'm lucky to have 3 windows, 1 in the bathroom, 2 in the treatment room. So ventilation is key to having a clean environment. So the room will be very airy and will be ventilated between treatments. I'm going to ask you to put your clothes in a box in the bathroom. It will be a clean box that I will have sanitised for your use so that your clothes can go in there when you get changed in the bathroom, and then you take them out, put them on at the end of the treatment, and I'll clean the box again for the next person. The wax that I use on your body, I will put into a little pot that's your pot of wax at the start of your massage. It won't be coming from the main pot, so that's a further step that I'm taking to avoid cross-infection. I should mention, I didn't mention the bathroom. Obviously, the bathroom will be completely cleaned, as it always has been. Summing up, I hope you can feel confident that I will be doing everything I practically can in terms of cleaning the treatment room and the way through my home to that treatment room, so that your chance of contracting anything while you're here is minimal. I can't say 0. Nobody can give 100% guarantees. This is the question I've asked myself repeatedly. Would my mother be safe here? Would I be happy for her to come here for a massage? She's 79, so she's in the risk group. I wouldn't advise her to go for a massage, but that's been my benchmark. And actually, yes, I would feel happy about that. So I am now as COVID secure in terms of hygiene of the treatment room and my home as I can possibly be. Here are my references that I've used. You can click on the links if you would like to check anything out for yourself. I will be checking these regularly for updates and updating my practice as I need to. And if you have any questions, please do get in touch with me. Either call me, text me, or drop me an email, jackie@purecalmmassage.co.uk. Thank you very much for listening.